Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video is probably going to be a little bit longer because we're going to cover the shoulder, but we're still going to try to get her done in less than 5 minutes. So I've got a model of the shoulder that I love here because it has articulated muscles that I can actually take off the model and show my patients when they come in. So when we're talking about the shoulder. So with the shoulder, it is called the shoulder complex for a reason. It's an amazing joint because the movement we have is phenomenal. We can just move it all over the place and lots of range of motion. So when we look at the shoulder complex, this is a right shoulder example. We have the clavicle or the collarbone here, and then we have the humerus, so it's been shortened here, or your arm. And then you can see this model has all of the rotator cuff muscles that are stacked in here. And again, I can peel those off and show people when they come in. But today we want to talk about the posterior or the back part of the scapula, meaning back here, how we're going to get in and roll that and get into the rhomboid muscles and then get into the pectoralis muscles coming off the front. So as you know, this is a part of a series. I'm hoping this will be the last one. And you can go back and just watch these. But remember, think of the foam roller as a paint roller, because I've had people who kind of miss the concept. It's a paint roller. You're going to paint yourself from your ankle, even the top of your foot, all the way up to your neck. For women, typically, you're going to skip the breast area. But for men, get in on the pecs and roll it, especially if you're lifting weights, bench pressing, doing handstands, and things like that. So I want to get into the shoulder. We're going to roll under here. We're going to start with the anterior serratus muscle. Again, when I have patients come in, we're testing over 18 muscles in the upper extremity alone, just on one side. And we do 18 on the other side. And we're doing a total of 100 different tests on a new patient exam. So the shoulder is so critical and so key, especially if you're active. So we're going to start with the anterior serratus. That's going to be this area right here. And remember, you want to go past the joint and come back. So starting here, hopefully you can see me okay. I'm going to have my arm out. Now again, for some of you, this might be excruciating in the beginning. In that case, put less weight into it. Maybe don't do it as long, but be consistent. You know, doing something 2 or 3 times a day versus, for 5 minutes is sometimes better than 30 minutes a day because you won't want to put that time into it. But work your way up. Start slow. So here, I'm going to have my arm out. And I'm going to roll here. So again, watch my lower body. For me, this area is not tender. So what I want to do is bring my body up and I want to put more weight into it. And I want to go past the shoulder and I'm going back and forth and rolling this, okay? And I want to roll and I kind of rotate the arm and I come through. So that would be a good way to do it. Again, you're going to do this on both sides. We're just going to show one. Next, if you remember on my intro video, I showed, how to do rolling on the back, okay? So with that, you can roll the back, but we want to focus on the shoulder. So we're going to grab the arm, we're going to pull it across. This is going to wing your scapula, open up the scapula. That's where your rhomboid muscles are, that computer word feeling tight between the shoulders. So we're going to pull the shoulder out, and then you're going to put your weight, lift your butt up, put some pressure into that, and roll it. And look for spots that hurt. So this is going to be the origin part for a lot of your rotator cuff muscles. So you're just rolling along the border there. And look for spots that kind of wake you up and go, oh, that's tender. That's where you want to be. And if it's too tender, just sit down and roll lightly. But if it's not, get your butt up and put some weight into it. So you're rolling the back. And you're going to do both sides. Then looking at the deltoid, we got 3 deltoid muscles. We want to work on each of those. So we're going to come down and we're going to do deltoid insertion point along with the rotator cuff. You're going to roll back and forth. So notice my hand is along my body or my arm, and you're going to roll this and you're going to move yourself so you get the whole glenohumeral area rolling back and forth. And if you find a spot that's really sore, spend some time on it, okay? And then real quick, just to continue from here, this is a great way to do the elbow. Keep your elbow along your body and roll up and down. And then rotate the arm, turn your wrist each way. And then if that's too much pressure, bring your arm out, take your hand, push on it, and roll that way. That way it's not so painful if it's really tender for you. But if it doesn't hurt, bring your arm under you. Put some pressure into that so you can feel that in the arm. Great for golfer's elbow and tennis elbow, okay? Next, don't forget about the muscles on the front of the shoulder. So we got the subclavicular and the pec major sternal, pec major clavicular. You want to get in and work those too, and it's so easy on this thing. So just come up. I'm going to take my arm, put it along my body, and I'm just going to put pressure into the opening here in my shoulder. So again, I'm going to lift my butt up in the air and put pressure on it and roll. I like to bring my head off the end and just roll back and forth into the shoulder, because the pec muscles I find a lot when it's been a chronic condition. And opening up the pec muscles can also open up some of the intercostal muscles there to make for easier breathing. So I think I covered everything. There's a lot of things I want to move on. I'm going to start covering some things on stretching. So I notice people don't stretch enough. If you watch some of these professional athletes, you got these, 7-foot tall basketball players who can do the splits. And you got these big guys weighing 250 pounds, 260 pounds who are doing the splits. And we know that the increased flexibility equals better health and less injury. So this should end the series for the foam roller. Please feel free to come back and look at those things. And if you feel I missed something, let me know so I can cover those additional areas. Have a great week.